We described the HIV life cycle and the mechanism of action of antiretroviral agents, and given a treatment-naive HIV patient, we recommended DHHS guideline concordant antiretroviral therapy. Now, when indicated, let's recommend immunization to patients living with HIV. Generally speaking, the immune response in people living with HIV is significantly lower. Even when the patients are receiving ART, the CD4 T lymphocyte remains significantly lower compared to people who do not have HIV. Even the B cell activation will be impacted by HIV, and this is most likely due to the persistent inflammation. Even in patients who have undetectable viral load, this inflammation persists. And in general, recommendations for vaccinations are similar in HIV patients, with the exceptions of a few contraindications in HIV patients, especially with CD4 count less than 200, because they will be severely immunocompromised, especially when it comes to live vaccines. In general, the data for vaccine effectiveness in HIV is very low, which has led to under-vaccination in people living with HIV. So we need to do a better job of vaccinating HIV. Let's take a look at ACIP recommendations for adults. For each vaccine listed in this table, we're going to look at recommendations for healthy people without HIV, and then we're going to look at recommendations for people living with HIV in two categories. One is people with AIDS, essentially CD4 count less than 200 or less than 15%, and these are considered severely immunocompromised, and those who have CD4 at least 200 or higher. For the general population, inactivated or recombinant influenza vaccine is recommended annually for the annual updated influenza vaccine. People living with HIV are at increased risk for influenza severity, complications, hospitalization, and mortality compared to healthy individuals. So it is, of course, also recommended that these individuals receive annual influenza vaccine. Of note, the live attenuated influenza vaccine is contraindicated with people living with HIV regardless of CD4 count. Whereas the general population, as long as they are aged 2 years to 50 years, they can receive live attenuated influenza vaccine, which is FluMist. For pneumococcal vaccines, for the general population, for healthy individuals aged 50 years or older, a PCV vaccine is recommended. And of course, if someone received PCV 15, it should be chased with a PPSV 23, which we will discuss in more detail on the next slide. They are also recommended for people living with HIV. They should receive PCV vaccine even prior to age 50. Hepatitis A vaccine is recommended for individuals who are at risk, and some of the increased risk for hepatitis A includes HIV, men having sex with men, either injectable or intranasal drug use, cirrhosis, or people who are homeless. For hepatitis B, the general population is recommended to receive a vaccine up to age 59 years. For people with HIV, regardless of age, it is recommended to receive hepatitis B vaccine. Other risk factors that require hepatitis B vaccine includes people with hep C, people who inject drugs, those with cirrhosis, with sexual risk, or men having sex with men. Tetanus and diphtheria is recommended as a booster every 10 years for the general population, and that includes people living with HIV. When it comes to meningococcal vaccine, there are different serotypes. So serotype A, C, W, and Y is recommended for people who have HIV, whereas for the general population, only certain individuals at risk need to get this vaccine. For people who live with HIV, regardless of CD4 count, they need to get boosted every 5 years. Serotypes A, C, W, and Y are more likely to cause meningitis in people living with HIV, whereas serotype B is not a high risk So therefore, HIV is not an indication for getting MenB. However, if they have other indications such as asplenia or complement deficiency, patients may receive MenB. And there are some formulations that combine all 5 into the same shot that may be available in the US nowadays. HPV vaccine is recommended for all individuals regardless of HIV status up to age 26. And then from age 27 to 45, it is a shared decision making for that group. Varicella vaccine is a live vaccine. It is recommended for individuals born after 1980. And it is contraindicated in individuals with CD4 count less than 200 since this is a live vaccine. However, it is safe to give to people with CD4 of 200 or more. And for people who have HIV, consider 2-dose series 3 months apart. For the Shingrix or recombinant zoster vaccine, it is recommended for all individuals regardless of HIV status after age 50. RSV vaccine has become available in recent years, and it is recommended for all individuals aged 75 years or older, regardless of HIV status, and for people aged 60 to 74 who are at increased risk of severe RSV, they may also receive this vaccine. Mpox, formerly known as monkeypox, there is a vaccine Jynneos that is recommended for persons at risk of Mpox infection, and this happens to have characteristics of sexually transmitted infections in recent time. So people who have HIV or other STIs are more likely to benefit from this vaccine. And last but not least, the COVID vaccine. It is recommended that people who are at risk of severe COVID-19 receive their annual vaccine, and that includes people aged 65 or older or those who have comorbidities. With regards to patients who are immunocompromised, and that includes CD4 less than 200, an additional dose may be necessary. In other words, if normally a person receives a single shot annually, a CD4 of less than 200 would require 2 doses annually because of the immunocompromised status. And here's a more detailed look at pneumococcal vaccines. So in general, these are indications for receiving pneumococcal vaccine prior to age 50, and that includes HIV infection. So for those with HIV infection, regardless of CD4 count, once prior to age 50, they can receive either PCV20 or PCV21, and if they do that, they are done. There is no need for PPSV 23. Alternatively, they can receive PCV 15, and 8 weeks later, at least 8 weeks later, they can receive PPSV 23. Now, if for some reason somebody has already received PPSV 23, a year later, at least a year later, they can receive one of the PCV vaccines, and that will complete their pneumococcal vaccination.